Hi, it's Jessica DeMassa with WTF Health. With me right now, I have the CEO of Kaia Health. This is Konstantine Mehl. How are you?
Very good. Thanks a lot for having me.
It's good to have you with us. So for those who are not familiar with Kaia, please explain what you guys do.
So we basically deliver mind-body therapy in an app, and it's like, psychological exercises and physical exercises. And a really cool thing is that we use the smartphone camera to give you real-time corrections on your physical exercises. So everybody can just download the app in 40 countries and get going. And we focus right now on back pain and chronic obstructive pulmonary disease. And that's two patients group that are pretty much left alone. So.
No, and that's so exciting. Your nature is like too modest almost. So this is one of the leading digital therapeutic companies, and not only because of your market traction, but also because of the clinical outcomes you've been able to show. So talk a little bit about those outcomes. What have you been able to accomplish just by people using your app on their phone?
Yeah, so we run a lot of clinical trials to compare our app against standard of care treatments. And we published one randomized controlled trial where we compared our app against standard of care physical therapy and showed that we have much bigger pain reduction for back pain patients, and also that we are really a long-term solution, because if you have chronic pain, you have it for several years, and the offline system just provides very short-term intervention. And then you're at home again and you have pain again, so you're looking for the next thing. And we are really this long-term interface that people like to use.
And I know, people do like to use your product, and you said it is available on the App Store, so people can purchase it to use it. And also you're working with payers to have this offer to different types of organizations, so employers in the US can offer this to their employees. Talk about that experience. How's that going? How's the reimbursement on that?
Yeah, so in the US, we actually see that the employers are very used to offering digital health tools to the employees. So they're very professional about it, and we have a lot of great partners already there. In Europe, it's a bit like 5 to 10 years behind, as always, and there are a lot of great initiatives, but it's much slower, right? And specifically, when you think about it, your employer in the US just sends you an email, there's this great app, we cover the costs now, just use it, you download it. But in Europe, when we partner with insurances, they don't even have the email address of their members. So how do you distribute it, right?
No, I think people are left to their own devices on the App Store then, right?
Yeah, exactly.
No, so do you think that that's going to be changing anytime soon in Europe? I feel like lately there has been a lot more attention on the digital therapeutic space, especially here, mostly because of the big relationships with pharma in Europe.
Yeah.
Do you feel like the tide might be turning on the way that, look at your smile, like maybe not. Tell me what your thoughts are. Be honest.
I hope it's turning, but it's not my first tech company, and I typically know that if you have to wait for a big change to happen, it's not fast enough for a venture-backed business. And so we are very, very fast. Our advantage is that we are very scalable. We can launch today in Australia or in Japan, and we don't need to wait for any big political decisions. But I'm happy if something changes. But in the US, things are already going very well, so I hope for the best, but if you ask me for the honest opinion, I think the main problem is that in Europe, even if you get reimbursement, you don't get it on a high enough level, and then the insurances cannot distribute it because they don't know how, right? So, and that's two very big challenges.
Those are very, very big challenges. So, kudos to you for taking this on. So tell us a little bit about the business. You had mentioned, you're not waiting for anybody to, reimburse you here in Europe. You've taken matters into your own hands. You're working on the app. You're launching it in the App Store. So tell me, though, where are you guys at? I know it's been a while since your A round. Are you raising money right now?
Yeah, so we are right now raising our Series B round, and we mainly want to focus on launching 3 more therapies. And then we'll have 5 therapies against the 5 biggest chronic diseases. And then we just want to become the biggest platform for chronic disease management.
Oh, is that all? That's it?
Yeah, that's very easy. It's very
easy as that. I love it. Fantastic. Last question for you. Where are you guys based?
So we have one office in New York and one office in Munich in Germany. And that's Munich is our product office and New York is our sales office. So we take advantage of the strength of both.
Awesome.
Thanks so much.
Thank you so much. I mean, it's such an exciting solution. I've actually played with your app before, and it is really cool. No, it's very awesome. I love it. One to watch, Kaia Health. You guys heard it here. I'm Jessica Damasa with WTF Health. Thanks for joining us.